More on the causes and treatment for back pain is Mercy Medical Center Dr. Harrison Linder. Good morning.
Good morning. How are you?
I'm doing good. So there's so many different ways you can treat this, and if someone is really having chronic back pain, it can be so frustrating. It can lead to depression.
Absolutely.
What is some of your advice?
So it's very important, when an injury first happens, to try to relax a little bit, rest. You can take over-the-counter anti-inflammatories to see if that helps. But we definitely don't want you to think that you need to be on bed rest and really take a long time out of work. The more active you are, the more physical you can be, even if it's just light stretching or a little bit of aerobic activity, has been shown to increase function and decrease the amount of time you'll miss work or be in pain.
All right, what if it's starting to impact your daily activity? So what if there are certain things you just can't do because it hurts so bad?
And so that happens frequently. So back pain can affect you from walking, even just getting comfortable lying in bed. And so that's probably the time to come speak to your primary care provider, or maybe come in and see us at the Center for Pain Medicine at Mercy.
What about cortisone shots for the back?
So cortisone shots absolutely have utility. Usually we start initially with some sort of over-the-counter medication, some physical therapy. If pain's continuing to impair your life, then we could talk more about minimally invasive procedures that really target the cause of pain and are really able to drastically help patients be more functional and decrease their intensity of pain.
How do you know when you need surgery for back pain?
And so that really involves speaking with your doctors, really trying as many treatments as you can. Surgery is absolutely the right answer for some patients, but if we can avoid it and keep people moving without having to have the recovery or risk of surgery, that's great as well. So it's really just a conversation with your doctors, consultations with surgeons, and kind of seeing where we're at.
Now, physical therapy is really an amazing thing, but oftentimes you get out of it what you put into it. So do you get frustrated sometimes with patients because they'll go to their physical therapy appointments but may not do what they need to at home?
Yeah, and so it's very tough. So especially with physical therapy, or even if people are doing yoga on their own or exercising, when you're doing those activities and those movements, it can be a little bit painful because you're stimulating those tissues and nerves that are injured. But over the long term, it will drastically help. And so that's always a conversation we have with patients, that in the short term, it may be a little uncomfortable, but it'll be worth it in the end.
Well, and you bring up a good point about feeling some of that pain. Sometimes feeling the pain is actually a good thing, right?
Yeah, absolutely. And if you're past the point of feeling the pain, that doesn't mean you're doing something wrong. But if you are feeling the pain, that means that we're working the right tissues and the nerves, and the risk of re-injury has been shown to be very, very low, so it is very safe.
All right, Dr. Linder, thanks so much for coming in.
Thank you for having me.
You're welcome. Come back.
Absolutely.
If you have any other questions or you'd like a referral, just call 1-800-MD-MERCY. And coming up in the kitchen,